with Dr. Benita Zahn.
As the COVID pandemic rages on, it's pointing up discrepancies in healthcare, particularly in communities of color. It's something we've been discussing here. So at the University at Albany, they are engaged in an interdisciplinary project to better understand the extent of this. Dr. Lynn Warner, the Dean of the School of Social Welfare at UAlbany, is one of the key participants and our Health Beat guest. Hi, Dr. Warner. Thanks so much for joining us.
Hi, thank you for having me.
This is really a continuation of a conversation that we started here at Newschannel 13 a couple of weeks ago about the discrepancy in care, healthcare availability and quality in communities of color. You're involved in a big project through UAlbany. Share with us some of the details.
Sure. So a couple of months ago, the University at Albany had the opportunity to be tasked with this large project to attend to minority health disparities and COVID-19. And the project has a very ambitious scope, which is to help the state to both identify the extent of the disparities that are being experienced in communities of color around the state, and to begin to identify important interventions that can be put into place now to both mitigate the consequences of what has been the disparity experienced so far in communities of color. We know that there have been disproportionate fatalities. We know that there's disproportionate exposure. And even though we continue to be learning at a really rapid pace about the implications of the disparities related to COVID, we want to be able to provide as much background information, on-the-ground research as we can to help the state make the important decisions that it needs to make to be able to prevent and mitigate even further disparities.
You know, time is marching on, and we're starting to see folks from other states where their rates are very high coming into New York, just the kinds of the situation that the governor had warned about and has been concerned about. So you don't have a lot of time. And in terms of some of the things that you're already learning, are you able to implement any changes to protect, communities of color today, tomorrow, next week?
Yeah, well, as a university, we have steps that we can take to protect our students and our staff. We are a very diverse community in and of ourselves here at the university. So at the very local level, there are certainly steps that we can take that are going to have implications for our students that are important to. Obviously, our students come from around the state. They come from diverse backgrounds themselves, making sure that we have a safe community environment for them to come back into. But in terms of I think the larger pressing question that you're asking about is, we can provide information. We can provide the best information that we can to the governor, the Department of Health, and all of the other agencies that have important connections to COVID and the disparities. So, we think about the health disparities are certainly front and center in terms of what has most recently been in people's minds, but we know that the disproportionate health consequences are really a combination of a lot of disproportionality in other areas of life, whether it's access to mental health services, access to food. And so as the project is developing here at UAlbany, what we're trying to do is to make sure that those intersecting threads that are important components of everyone's well-being are part of the conversation in terms of the interventions that need to be implemented need to really be holistic.
And there's the institutional racism in so many of these hierarchies, and to tear them down doesn't happen overnight. And is it starting with one thing and then another, or do you really have to do this in a holistic sense, that every aspect of the problem identified has to be addressed at the same time.
Yeah, that's an excellent point. And I advocate, yes, it has to be addressed at the same time. And I think that whatever avenue people's roles are, whatever role people have in contributing to our society, we all need to be cognizant both not only of COVID, but of as we make changes to keep our society safe, we need to make those changes in a way that have our eye toward, is this change going to be equitable for everyone? And so if we can, while we might not be able to attend to everything at the same time, if we do it with that lens of a health equity agenda and a health equity goal, then I think that would be sort of a foundational principle upon which all of the interventions should ride.
Is there a particular date when you Albany, your community, is supposed to make a report to the governor and say, here, these are the 10 marching orders we'd like you to follow?
We definitely have a date by which our report is expected, and that is the beginning of December, so in December. So not a lot of time, as you say, to pull together a lot of outstanding researchers who have a lot of experience, also who have a lot of connections with community partners, who I think are going to be an incredibly important component of informing us and informing the recommendations, so that we are able to acknowledge the fact that New York State is a diverse state. And so while we may be thinking about the concerns around the disproportionate impacts for Black and Latinx populations, we know this from the data. We also know that there are different access issues in different parts of the state. Well, and so having that kind of local information and local expertise also informing these recommendations by December is part of our task.
We'll be keeping our ears attuned to that, and I'm sure if there's actionable points that come out ahead of it, they would be, of course, embraced. So let's stay in touch, and we'll continue the conversation. Dr. Werner, thanks so very much.
Oh, thank you. My pleasure.
Thanks for checking out this edition of Health Beat. New programs post every Monday and Thursday. We'll see you next time.